Today, we're zooming in on a microscopic organism that has a huge impact on human health. It's a single-celled parasite called Entamoeba histolytica. It's the perfect example of how something you can't even see can cause some very real and very serious harm.
And that really brings us to the big question, right? How can one tiny cell be responsible for such devastating intestinal disease and even life-threatening abscesses? Well, let's find out.
Okay, so first things first, let's get a proper introduction to our antagonist here. Who exactly is this invisible intruder?
So Entamoeba histolytica is what's called a protozoan parasite. Basically, you can just think of it as a tiny animal-like cell that has to live inside a host to survive. And in this case, the host is us. This little guy is the culprit behind some pretty serious conditions, most famously amoebic dysentery and nasty liver abscesses.
Now, to really get how this parasite works, you need to know about its kind of dual identity. It has two completely different forms. First, there's the cyst. We can call this one the traveler. It's dormant, wrapped up in a tough protective shell that lets it survive out in the harsh environment. This is the form that actually infects us. But once it's inside, it transforms into the invader, the trophozoite. This is the active, mobile stage that gets to work and starts causing all the damage.
So, that's the big question, isn't it? How does the traveler even get inside in the first place? Let's take a look at how this whole invasion kicks off.
The journey almost always begins through what's known as the fecal-oral route, and it's pretty much what it sounds like. A person swallows those tough, infectious cysts, usually from food or water that's been contaminated with fecal matter from someone who's already infected. And a really key point here is that there's no animal involved. This is a uniquely human-to-human cycle.
Once those cysts are inside, that's when the real story begins. This is where the invader is finally unleashed and starts to cause all sorts of damage from the inside out.
So here's the step-by-step assault. First, the cysts arrive in the small intestine, where they hatch into those active trophozoites. These invaders then move on to the large intestine and start their attack. They release enzymes that literally dissolve the tissue of the intestinal wall, causing it to die off. This creates these classic flask-shaped ulcers, narrow at the top and wide at the bottom. But it doesn't stop there. The trophozoites can burrow even deeper, right into the bloodstream. From there, their most common destination is the liver, where they can form huge, damaging abscesses.
So with all that chaos happening on the inside, what are the warning signs on the outside? Let's decode the symptoms.
And right here is one of the most crucial and frankly kind of scary facts about this parasite. It's the key to its success. A staggering 90% of people who get infected show no symptoms at all. They become asymptomatic carriers, silently shedding cysts and unknowingly spreading the parasite. And that is what makes this invisible intruder so effective and so dangerous.
Now, for the 10% who do get sick, the symptoms really depend on the type of infection. Acute intestinal disease, well, that presents his classic dysentery. We're talking bloody, mucus-filled diarrhea along with abdominal pain. Some people develop a chronic version with milder on and off symptoms. And if the parasite has managed to spread to the liver, the signs completely change. You're looking at fever, weight loss, and a very specific pain in the upper right side of your abdomen, right where your liver is.
So how do we find this microscopic intruder? And more importantly, how do we fight back?
The diagnosis is surprisingly direct. It all comes down to taking a stool sample and looking at it under a microscope. Technicians are literally searching for either the traveler, the cysts, or the invader, the trophozoites. It's really just old-school detective work, but on a microscopic scale.
The good news is, once it's diagnosed, the treatment is very effective. For active, invasive disease, doctors use drugs like metronidazole to kill the invading trophozoites. And, this is so important, even those asymptomatic carriers need treatment. They get a different medication to clear the cysts from their gut, which is absolutely essential to break the cycle of transmission. And get this, even large liver abscesses usually resolve with medication alone. They typically don't need to be surgically drained.
Of course, the best fight is always the one you never have to start. So let's wrap this up with a practical prevention playbook.
Ultimately, prevention really all comes down to sanitation and hygiene. This means ensuring you have clean food and water, practicing good hand washing, and having reliable, purified water supplies. It also means stopping practices like using human feces, sometimes called night soil, as fertilizer, because that's just a direct way to contaminate crops with these infectious cysts.
So in the end, the story of Amoebiasis histolytica is just a really powerful reminder.
It shows us that sometimes the biggest threats to our health are the ones we can't even see, operating silently until the damage is already done. It kind of makes you think, what other invisible challenges are shaping our world right now? That's something to chew up.